And yes, I do hope the SHAREeClinic will address some of that, because you're right, sometimes you've just heard the word cancer and you're not listening to all of the side effects. And so the SHAREeClinic is going to be an option, I hope, that will help with that. So the SHAREeClinic is a pilot project. We are part of, so it's called the Sexual Health and Rehabilitation E-Clinic. So it is a virtual clinic. And it was, like Dr. Dome said, it was piloted, it started in Toronto at Princess Margaret Cancer Centre, and they found it quite successful. And so they are now implementing it across the country, and we are one of the sites that they have chosen, and we've got the support of Dr. Domes and the St. Paul's Hospital Foundation to start this program up. We've got funding for 3 years, and of course we hope to make it permanent. But we're just getting started now. So it was designed by a multidisciplinary team of healthcare experts from across Canada. So really this program has your most up-to-date information on sexual function and sexual dysfunction in prostate cancer treatment. And so yeah, this is part of the Canadian Cancer Society Research Institute. We've got funding through a challenge, the Canadian Cancer Society Challenge Grant, and additional funding through St. Paul's Hospital and Foundation. And we are very, very thankful, because this wouldn't be happening without them. All right, so our goals really are to improve the access to care for sexual health, the access to sexual health care, improve patient satisfaction. We want to support you to be able to manage the side effects of your treatment and support your sexual health. We want to enable secure communication with your provider and virtual access across the province, so not just in Saskatoon. And of course, we do want to build a sustainable sexual health clinic. And we want it to be, like Dr. Dome said, the standard of care going forward for prostate cancer treatment. So it is a biopsychosocial approach to care, and I know Dr. Dome's mentioned that, and what that means is, like, we look at the biology, so that's like the physical components. We're educated in talking about the PDE5 inhibitors, the injections, all of that, the biological components. We know how the erections work. We know all of that kind of stuff. We know the biology, but we're also trained to look at the psychology. That's the psych part. So that's how it's impacting your mental health. That's the mental health factors that are involved, whether that's stress, anxiety, fear, all of those things. And then the social part, and that's your relationship, because they call prostate cancer, it's a couple's disease, right? Because it impacts both partners. It impacts your relationship, and we want that all to be addressed in this model, okay? So it is tailored content, and I'm gonna show a little bit of what the app looks like. But when you sign up for the app, you are selecting whether you're in a relationship, what treatment you had, and then the education you're receiving is tailored for your situation. You have clinic visits. So those are clinic visits where you go online, you do a module of learning related to your treatment and where you are in your recovery or prior to treatment. And they're quick, 30 minutes, hopefully, to try to make it digestible, so it's not too big. And then you have the human facilitation. So that's the sexual health coach, sexual health counselor, and that's me. Right now in Saskatchewan, that's me. So I am there for you throughout the whole thing. We can talk over the phone. There's a chat box, and I'll show you that on the screen, where you can put your questions in the chat to me, and then when I have a chance, usually they say within 24, 48 hours, I will answer those questions as best as I can, or we'll book a session where we can chat over the phone and talk about it more. And then there is on this app also the option to do some tracking around like erectile firmness, around sexual satisfaction or distress, different kind of trackers that you can use if you want. Those are optional. And then we also definitely encourage the involvement of your partner. Because it is a couple's disease, we encourage the partner to be involved as much as possible, because that's really going to make it more successful. So for this Saskatchewan implementation, I did want you to know we're doing a gradual sort of phased implementation. We are hoping to begin onboarding patients in January. It is going to start with newly diagnosed patients, and that is a requirement of the research study that we're doing. That's the population they're looking at, because the very first learning module is pre-treatment. So we would like to catch people before they've had treatment, so they have a more realistic understanding of what is to come and can do some of those steps to prepare themselves to have maybe hopefully better outcomes. But we also are going to onboard a small cohort of already treated patients. The exact timeline and patient criteria is still to be determined. So hopefully I'll be able to share that with you guys soon. But you can contact the SHAREeClinic directly or provide your contact information to me and if you're interested, and we will let you know when you are eligible to register. So here's a look. This is 4 separate screens, but here is a look at kind of when you're onboarding, when you're signing up. You're going to get a code to put in, and then you're going to select which treatment you had, when you had it, or when you're scheduled to have it if you haven't had it already. You're going to select if you're in a relationship and some information whether you're straight or you're gay, because the content is going to be tailored to that as well. And then you're going to be introduced to your health coach, which down the road there may be multiple health coaches, we hope. The program is wildly successful and we have lots of me, but right now it will be me. And this is kind of what your dashboard will look like, okay? So you're going to have a screen here with like when you have a clinic visit coming up. If you have a call booked with me, that will be on there. The trackers are there, and it'll show you your most recent recorded tracker if you're using those. It'll show you who you've added to your circle of care. That will be yourself, your partner, hopefully, me, and then you also have the option to give your provider, your urologist or your family doctor, access to this. I'm not sure how it works on their end. I haven't learned yet. Yeah. Well, how they sign up.
In a highly integrated clinic, it works really well. For us, that might be phase 2.
It might be phase 2, but ideally, we can include you can include your care provider so they can see your updates. So one of the great things here is this health library. And that is where you can go, and I'll show a screen that shows that a bit later, but that's a screen where you can go and it's got all of the, you can search anything. You can search about the injections, you can search about PDE5 inhibitors, you can search about really anything. They've got a massive, massive library, and this is all stuff that has been vetted by healthcare professionals. So this is going to be information that you can trust. Yeah. Okay?
A lot of it was developed at the Princess Margaret, but also Vancouver Prostate Cancer Center.
Correct.
We will have some of our content on it.
Yes.
So it's a great resource because really it's Canadian trusted content that's specific to the Canadian content.
And I'm going to step in front of the screen for a second because I'm going to show you up here is your little chat box. And that's where you're going to go if you have questions or if you want to talk to me. You can put something in there. And I will get that and I will respond. Okay, so you can use that at any time. And if you're looking at this at 10 o'clock at night, you can put something in the chat. Don't worry. I'm not going to respond at 10 o'clock at night, so I'll be trying to fight my kids into bed. But I will respond either the next day or the day after that, and we'll get a conversation going. So that's kind of what your homepage looks like. So this is the way the program is designed. And so it is designed to start with pre-treatment. They have a pre-treatment visit, a 6-week post-treatment visit, 10 weeks, 4 months, 6 months, 12 months. Now, a lot of you have probably gone through treatment already. I've talked to the team in Toronto. All of the education that's on here is still very valuable to you. This is the way it's designed, and so we are going to onboard new patients. But you just have to, if you know that coming in, you'll know that these clinic visits, they're still going to be helpful to you. You're still going to learn valuable information. It's just the timeline's maybe going to be a bit off for some of you that have already had treatment. But ideally, we capture those before they have treatment so that they can have this learning in advance and so that they're not, shocked or disappointed or left feeling like they wish they knew. So here's another page with some screens showing you kind of what this clinic will look like. So these two are different clinic visits. So clinic visit 1 and 2. I think I don't even know if this is the surgical or radiation option. I'm not even sure. But you'll see they have little modules to go through. These modules, I've heard, are quite engaging. They've used videos. It's not just reading. So there's videos, there's interactive little quizzes, things like that to make it more engaging, and they're about half-hour long. And they provide you the content that you need at that point in your treatment or your recovery. Okay? This one here is kind of a look at the health library. So there is tons of topics, and there's a search bar. I don't know if you can see it real well on this. No, not very well. But it's a massive library. I asked for a list, and the list was pages long. You asked for a list,
Yes,
actually, and I was going to get it to you,
Yes.
but it's like...
Yeah, and we'll probably, before we, we'll probably customize it so it's not overly
Yeah.
overwhelming.
It's a lot of material. They've worked
Yeah.
very, very hard on this.
Yes.
Yeah. And then this is just an example of one of the trackers that they use. So you can slide the scale to, this I think one is erectile firmness on where you are. And so if you're tracking that, you can see if some of this education and some of the things you're trying is working. You can look back and see, where was I last month? Where was I the month before that? Because sometimes it's hard to remember, right? And so these trackers can just help you gauge and help you, give you the information. So when you're talking to your healthcare provider, you can say, hey, look, the erectile firmness has really stayed the same. I'm still at a 5. It hasn't changed in 2 months. What can we try next? This isn't working. Or you can say, actually, I've gone from a 5 to a 7, you know? But you can show that with the data you're collecting. So the SHAREeClinic team, like I said, that's me. I'm Jennifer Bond, so I will be the health coach. I have a background in social work. I completed my bachelor's degree in 2011, and I am almost done my master's. I was just speaking with Dr. Domes about that this morning. I've submitted my thesis for defense, and hopefully we'll be doing that soon. And I've got 14 years experience working in healthcare and 5 years working in clinical counseling practice. So I think I've got a pretty good background to be able to support prostate cancer survivors, and I'm really, really excited for the opportunity. The other individual on the team at this point is Alisar, and she is our research analyst. So she is supporting the research component to help us support the study in Toronto. And of course, we're going to, do a little bit of work here on our own as well. So you may be in touch with her as far as some, patient feedback or things like that, because of course, we love to hear how this experience is for patients so we can make it better, really, ultimately.
Yeah. And that's so key, because the only way we will have this as a long-term, beyond the pilot phase, is to have this research.
Yes.
And to show benefit to the patients. Us saying, oh, it worked great and, everyone loved it, without having that research backing, the government will just, so we owe it to Lucina's team and our funders and those that are donating to be able to provide this high quality research. And we're fortunate to be doing it with collaboration with others around Canada that have vast experience in this space.
Yeah.
And so it really is a gift. And we're in the studies. It'll be unique because we'll be able to tell there'll be a section like the Saskatchewan story, right? And so we'll be able to craft that, which will be cool.
Yeah.
Because the way we're doing it will be very different than how it's done in Toronto. Because
the needs
our
of
context
Saskatchewan
is
are
different.
very, very different than an urban Toronto, right?
Exactly.
So we get to show our story, but we definitely need your help with that. We need the feedback, because those stories are really what is the most impactful to the funders.
Yeah.
So
Exactly.
that's fantastic. And that's it for my presentation. Does anybody have any questions? Yes.
Will there be an opportunity for face-to-face contact?
At this point, it's designed to be a virtual clinic, and the office space I've been provided, I'm not allowed to have clients in because of the fire system. We don't have sprinklers at the St. Paul's Hospital C wing.
Online Zoom or something like that?
But I'm hoping that down the road that is a possibility, whether that's out at the urology center and booking a room there or some things like that. But at this point, the space we're working with doesn't allow me to see people in person.
Would you do Zoom?
okay?
Would I do Zoom? Absolutely.
Yeah, that might be an
Because
option.
I think that's an important component of this.
Yeah.
Yeah,
We're gonna
absolutely.
actually be able to look at somebody and talk to them instead of
Yeah.
do it sort of remotely.
Absolutely.
through an app.
Yeah.
Does SHAREeClinic have anything to do with active surveillance?
At this point, the SHAREeClinic doesn't, they don't follow, the research study is